for those of you who do not know, um, the City Health Dashboard, our goal is to help cities and communities across the US learn to leverage and empower themselves with data in order to improve the health and well-being of everyone in their community. And we do that by providing over 40 measures of health and the social drivers of health, the economic drivers of health, the physical environment drivers of health, for roughly 1,100 US cities. And that's, just this past data release, we added around 129 cities to the dashboard, which brought our city list up to over 1,000, which is a very exciting milestone. And you can see here, we have really wide coverage and broad coverage across the United States. And when we were building the site, and as we've managed the site over the past 6 years, our main, part of our mission is to create this really easy to use, easy to understand one-stop resource for city leaders. But we sit in the Department of Population Health at NYU Grossman School of Medicine, so we are within an academic institution. So when we were, developing the site and figuring out how were we going to design a site that met the needs of a diverse group of audience and users, it was essential to us to get feedback, to get that perspective from the city leaders. So that's been made possible through partnerships with organizations like ICMA or the National League of Cities. And as we've grown our site and added cities, added measures like what you'll see today, it's been through conversations with folks on the ground who are doing this work and really help us create what the site is today. And so a bit about our measure selection. So all of our data comes from national data sets. So that means that not only can you trust the data sources that we use on the site, our data sets are typically federal data sets that come from the CDC, the American Community Survey, which comes from the census, the National Vital Statistics System. These are all data sets that we trust as academia, and they all have very rigorous methods of collection. And on top of that, they reflect public health priorities and are amenable to city level intervention. So it really matters to us that not only are these measures, just available, but do they represent challenges or issues that city leaders care about? And on top of that, is it issues that city leaders actually can move the needle on? Is the lever of power, the lever of change at that municipal level? And then finally, all of our data is updated regularly and balanced over 5 overarching domains. So you can see all of our measures that are available here. We have over 40 measures. I think it's actually 43 or 44 at this point. And all of the metrics are balanced over these domains of clinical care, physical environment, health outcomes, health behaviors, and social and economic factors. And all of the measures that are listed in navy are available at just that city level, whereas the measures listed in gold or yellow are available at both the city and the neighborhood level. And then where you see that people icon, though we have demographic breakdowns available for those measures as well. So we really have we take a very broad look at the social determinants of health and place equal emphasis on your traditional health measures as we do on those social determinants. But how can you actually use the City Health Dashboard? When you come to the site, what do you do when you get there? So we've highlighted here what we see as 3 main use cases of City Health Dashboard data. And the first is to be able to compare health gaps across neighborhoods. I pulled out a map or a screenshot of life expectancy at the neighborhood level in Columbus, Ohio. And I've highlighted 3 neighborhoods that are next to each other, but that have very, very different life expectancies. And these neighborhoods are less than 2 miles apart. So someone living in that leftmost neighborhood can expect to live 60 years, whereas folks living in just the neighborhood next door can live or can expect to live 20 years longer. So the dashboard's really useful in helping you identify those gaps and then digging into what could be causing or contributing to those gaps or disparities. You can also use the dashboard to compare your city to cities in a similar region or cities with a similar population size, cities in your state, or cities with a similar demographic. And then finally, the dashboard's really useful in helping folks set priorities and target their resources towards the neighborhoods, the communities, the demographic groups, the issues that really need the most help. And then pivoting to the website, the dashboard is a totally free tool, completely accessible to anyone as long as they have an internet connection and a computer or a tablet or a phone can access all of the information that the dashboard provides. There's no need to create a username or a password. Everything is free, nothing is behind a paywall. And you just have to go to www.cityhealthdashboard.com to access everything. So I'll just do that now. Okay. And can everyone still see my screen? Dana, can you give me a thumbs up? Can you see the dashboard? Okay, cool. So when you get to the dashboard, all you do is type in your city name. I'm going to type in Huntington, West Virginia. And then you're brought to this metrics selector, where you can see all the different measures that we have available, the same measures that I just highlighted in the previous slide. So if you know what you want to dig into, you can feel free to kind of dive into any of these. But if you want to see more of an overview, and you don't know what you want to kind of explore, you can go to the city overview page, which provides a high-level snapshot of a city's performance across all of our measures. And so you can click into each one of these to see, a thumbnail of the city, some information about the metric, a description, the data source that we use, and all of that. We also provide really, and I'll go into this in more detail later on in the presentation, but we provide really detailed demographic information at the city and neighborhood level as well. So you can see what racial, ethnic, demographic groups live in your city, what are the age breakdowns of in various neighborhoods in your city, and there's a lot to dig into here as well. But moving on, I want to focus today on children in poverty. And so what's great about the dashboard, and one of the reasons why we see ourselves as being a fairly accessible website to a wide variety of users, no matter where they are in their data expertise, is that we have a lot of what we call visual signposts that help and orient users to what they are seeing on the dashboard. And once you get a sense of how we communicate about data, how we visualize data in one metric, in one city, you know how it works for all of the 1,100 cities on the dashboard, all of the different measures that we provide. So you can see here, we're looking at children in poverty in 2022. And at this point, I want to say like 99% of our measures, we have multi-year data available. So when that feature is available, you can just click on the year here and see all of the years that you can kind of toggle between. You can see a quick definition about the measure, again, that source, the level of data we have available, as well as some more information, an opportunity to dig into even more information here. Then the scale bar shows you or represents the range of values for that measure. So, in Huntington, children in poverty levels range from 0% in one or multiple neighborhoods to 78%. And these blues kind of tell you what's happening on the ground. So across all of our measures, deeper colors indicate poorer outcomes, and lighter colors or lighter blues indicate better outcomes. And this triangle this check mark in the circle will tell you the direction of those better value or those better outcomes. So for example, children in poverty, you want less of your children experiencing poverty or living in poverty. So this check mark will be on the lower side of the scale, whereas for a measure like high school completion, you want more of your residents completing high school or an equivalent degree. So that check mark would be on this side of the scale. And then this blue triangle tells you the average of the dashboard cities. So this is the average of all 1,100 cities on the dashboard. It's similar to a national average, but because it's not, every single place in the US, we can't say it's a national average, but it's pretty close and it's a pretty good proxy. And then this gold bar tells you the city or the neighborhood level for that measure. So in this case, 16.5% of all of the children on the dashboard are experiencing poverty or living in poverty. And that's compared to 36.5% in Huntington, West Virginia. So Huntington is doing worse than the dashboard city average. And then this green check mark here would be shown if that city or that neighborhood was doing better than the national or than the dashboard city average, but in this case, it's not. So if we just hide that key, you can see the neighborhood level map of children in poverty in Huntington, West Virginia. So like we saw with life expectancy in Columbus, you can see really at a glance what neighborhoods are doing better and what neighborhoods are doing a little bit worse or need a little bit more help. So you can click into any of these neighborhoods to see more information. So we have this neighborhood here where roughly 72% of children are living in poverty, and right next door, only 5% of children are living in poverty in Huntington. You're able to save census tracts, and you can do so. You can see those by clicking those stars, and then your saved tracts will be here. You can also highlight tracts on the map by clicking this eye icon. And so when you click that eye icon, it gets highlighted on the map here in purple. So yeah, you can click and kind of dig into what's happening on the ground. Moving on to demographic detail for around 1/3 of our measures, and I think all of our measures where we don't provide neighborhood level data have demographic data available for them. So you're able to see not only geographic patterns about how poverty is spread spatially across your city, you're able to dig into that from a racial equity and age lens, a gender equity lens, and you can see what this issue looks like when you're like comparing different race ethnicity groups. Then comparing cities, it was really important to us that cities, and this was something that we heard from or we heard a lot from city leaders, is that they wanted the ability to compare what's happening in their city to what's happening in another city to help them benchmark their performance. So we provide 2 ways to do that. The first is you're able to enter your city just by typing it in. I'll do Charleston, West Virginia, the state capital. And when you type it in, that scale bar is just brought down right below Huntington. But perhaps you don't know what city you want to compare yourself to, or you are always compared to one city and you don't really think it's a fair comparison. You want to see what's out there, or what cities are out there that might be a more applicable comparator to your city. So we have a couple ways to do that. And we have the city finder, where you can select all of the different criteria that make sense to you or that are meaningful to you and the work that you do. So you can look at cities with similar population sizes, cities with similar, maybe the adjacent states, so Kentucky, Maryland, Ohio, Pennsylvania, Virginia. And as you click on more and more of these characteristics, the list of cities that meet those criteria gets whittled down. And perhaps let's do cities with a similar population that's living below the federal poverty level. So now we have what was 38 cities, now is whittled down to 4 cities. So we can just do Harrisonburg, Virginia, Chester, Pennsylvania. And then again, just like we saw with Charleston, you can see the scale bars for Harrisonburg and Chester brought down and kind of visible in one view for that user to compare what's happening. and see how it kind of compares to Huntington, our original city. Then moving along, we have this compare metrics tool, and this is one of my favorite features on the dashboard, and I think it's slept on because it's a little bit hidden on this navigation bar. But as you all know, who for folks working in the field, working in in cities, a lot of the issues that we try and present data on are large, complex issues. They don't exist in a vacuum. They don't kind of exist in a silo. They're very interrelated to many other different types of challenges that are happening in cities across the country. And so we wanted to, have a way for users to see potential relationships or geographic patterns that exist in cities, to help them make those connections and see those associations. So we have this compare metrics tool. So you can see your first metric, children in poverty, and you can select another measure. So maybe I want to look at diabetes rates and how that relates to poverty. So you're brought to this map, which looks very similar to what we just saw for children in poverty, where our original measure, which is represented by the blue polygons, is that base map. And now we see diabetes rates represented in those pink or those red dots. But again, lower values are indicated by lighter color, or better values are indicated by lighter colors, and poorer outcomes are indicated by darker or deeper reds. So you can see in quite a few of these neighborhoods, as we might expect, where children in poverty is higher, diabetes rates tend to be higher. And so you can click in again to each one of these neighborhoods to see more about each of those metrics and how they compare. I think it's also interesting when the pattern that you expect to see doesn't necessarily align. So for example, here, it's very low poverty, but high diabetes rates. What's happening in that neighborhood? How can we outreach or provide programming that is sensitive or resonant with that community? You can see that same data in a scatter plot view to see whether or not there's an association or a correlation between two measures. There doesn't seem to be a big association between the two, but it's still useful to see how these things compare both in neighborhoods and statistically. And again, each one of these dots indicates a census tract or a neighborhood, and you can click into them to see the estimates for both of those measures. And then I do want to just draw your attention to two more things. So the first is take action. We like I said, when we designed the site, we wanted it to be a one-stop resource for people. So we didn't want to just provide all of this information and all of this data to then have people be like, okay, so what? Like, what am I supposed to do with all of this information? Where do I even start? So we have what we call the take action section, which provides, I think at this point, around 500 resources that are broken out into these 5 different buckets of what you can do. So the policies and programs that have evidence to support moving the needle on all of the measures that we provide. So you can see here, we have 15 different policies and programs that have been proven to improve poverty in cities. But then we also have the how you can do it. So we have Find Partners, which identifies, potential organizations that you can reach out to increase the amount of seats you have at your table to move the needle on these issues. We have resources or tools that help you communicate about data, that help you engage communities more effectively, that help you talk about data or talk about the social determinants of health. A lot of people still don't really know what the social drivers of health means. And so we have tools that help you do that. I'm sure everyone on this call knows that there's never enough funding, there's never enough resources to do everything that we want to do. And so we wanted to connect folks to opportunities for grants or for funding. So we have that here. And then finally, we have resources that are that focus on, evaluating impact and measuring, are the outcomes or outputs that we're expecting to see through a program or policy actually what's being felt in the community that we're hoping to serve? And then finally, I do want to just flag what we call impact stories. These are dashboard use cases. And I think they're really important to highlight, because a lot of questions that we get from users are, what are other communities doing? Like, how are they putting data to work? And so we have this depository that's growing, basically on a monthly basis. We're always adding new stories here. So these are all examples of how local communities across the country, and communities that really range in size, they span the country, and it's a bunch of different use cases. We have use cases focused on university. We have use cases focused on health departments. We have impact stories that look at cross-sectoral groups. So it really runs the gamut. So if you're interested in exploring how cities have used the dashboard in their work, please explore or go to the cityhealthdashboard.com/impact page. So with that, I will go back to the PowerPoint. And just make sure that I'm sharing. Of course, I had to go back to the beginning. So, and let me just check the chat to make sure that there's any questions before we kind of go into the July data release. So we have a question from Lauren. When looking at a map of your city and you see a darker shaded area of concern, is there a way to put out the names of the streets in that section? So that's a great question. Let me go back to the dashboard. So there's not an easy answer to this, but I will show you a little bit of a trick if my internet wants to work. So let me just go back to Huntington. I can never spell when I'm sharing my screen. Okay. So let me just hide this. So if you zoom in, let me just hide this as well. The more you zoom in to the map, the more detail in the base map you're able to see in terms of the different streets or thoroughfares in your city. So you can see not only major highways or parkways, but you can also see, 5th Avenue, 6th Avenue, 8th Street. So you can see more detail of your city in the base map. We are exploring different ways to show more detail while not just clogging everyone's view with a lot of information. So that's a great question. Any other questions before we dive into the data release?
There is one more in the chat, Sammy.
Oh, yes. So in my city, this is from Christina. The census tracts are based on the 2010 census, and there's been a lot of growth and changes in census tract boundaries. Are there tract maps with census 2020? I actually think that the census tracts are based on 2020, but if you're not seeing that, Christina, I will check with data analysts on my team, because maybe I don't have the right information. What city are you in? And feel free to take yourself off mute as well.
Hi.
Yeah.
So yes, I am living in El Paso, Texas, and we downloaded some data by census tract, and we also downloaded some census data. And we were wondering why there was so much missing data. And then we went back and we checked, and it turns out that the data in the dashboard, the census tracts are 2010 census tracts and not 2020.
Okay. I will check and get back to you about that. Christina, will you actually, no, I do have your email if you registered for the webinar, but feel free to leave your email
Okay.
for me, or just chat me, and I will make sure to get the right information and vote and connect you with with the correct person on my team who can help you or help answer this for you, because I think I'm a little bit out of my depth with that question.
Okay, thank you.
Of course. Okay. So July data release. So like I said, just a few weeks ago, we had our annual July. So, we have various updates throughout the year. It's one of the pillars of our mission to have regularly updated data on the site, but we always do a really big data release in the summertime. And this summer was no different. We had one of our largest data releases to date where we updated 129 new cities. Or sorry, we added 129 new cities. We added 2 metrics. So we added a measure of independent living difficulty and voter turnout. We added new years of data for 22 metrics across 4 of our 5 domains. And so now for those metrics, you see the most recent year of data available for those measures. And then finally, we updated racial ethnic categories to reflect new methods. And so digging into each one of those updates. So for new cities, 51 cities that we added are through our annual Put Us on the Map challenge. This is a challenge where we invite small cities with populations between 1,000 and 50,000 to apply to be added to the site. This is a completely free, it's totally free for cities to apply. They just need to have that smaller population size and tell us why data would be of use to them in their city. And it's a very easy application. We open it every February. So if you know of folks or you have partners in smaller cities and you think that data would be of value to that place, please tell them to apply to the challenge when we open it again in 2025. So we added 51 cities through that initiative. We added 43 census designated places. Traditionally or historically, we've only had census incorporated places available on the dashboard, but we've expanded our definition of city to include these new CDPs, as they're called. We've also added 35 historically redlined places. This is a bit of a teaser to a new feature that we're adding to the dashboard this fall. We are adding the Homeowners Loan Corporation, which was a New Deal program that existed between the 1930s and 1960s. Maybe many of you know what redlining is, but for those who don't, this corporation went into cities and assigned grades to different neighborhoods in the city to denote or to assign or to basically tell the Federal Housing Administration whether or not to grant loans to those places. And in neighborhoods where there was a higher majority of Black residents, of Hispanic residents, of Irish residents, Jewish residents, those neighborhoods were marked in red or given grade D, and neighborhoods that were typically higher income and whiter were given A grades and marked more favorably. And we're still seeing the impact of this grading scheme in cities to this day. So we in the fall, around December, we will be adding roughly 400 different maps or redlining maps to the dashboard, and there were 35 cities that were formerly redlined back in the 1930s that were not current dashboard cities. So we've added those 35 cities. And then finally, we've added 3 island communities in Hawaii. Looking at new metrics. So the first metric that we added was voter turnout. This was something that, has been high on our mind, not for any political reasons, but as you all probably know, social cohesion, social connectedness is becoming much more widely recognized as a factor in community well-being and population health. And the value of, social connection was really underscored by the pandemic and has been echoed by the recent US Surgeon General's advisory in 2023. But there isn't really a good measure of social cohesion. So our team has spent a lot of time researching what we could present that could be a proxy for social cohesion or social connectedness or civic engagement. And so we've identified this voter turnout measure, which measures the percentage of voting eligible adults who voted in the last general election. We see civic participation as a sign of civic engagement and social connectedness. And this measure is available at both the city and the census tract level. We only have 1 year of data available, and that's 2020. And the data source is L2, which is a nonpartisan organization. And this metric is housed in our social and economic factors domain. The next metric we added is independent living difficulty. So since we launched the site in 2018, one of the most common measures that we get asked about is some metric of disability, and why don't we have a measure of disability? And for a variety of reasons, it's been hard to add that to the site. So like I said before, we only provide data from national data sets, and that sometimes makes it hard to, we might want to add something, but the data just isn't there that is available for the wide range of places that we have on the site. But thankfully, we were able to add this new measure this month, which is independent living difficulty. And that is the percentage of adults who report difficulty doing errands alone because of a physical, mental, or emotional condition. So it's a measure of disability. And so this metric is available at the city and the census tract level, so at the city and the neighborhood level. And we have multi-year data available as well from 2015 to 2022. It comes from the American Community Survey, and it's housed in our health outcomes domain. And then moving on to the measures that we updated with new years of data. So like I said, 22 measures got updated, and you can see the variety of metrics that have that new data. It really runs the gamut. And we have, for measures that come from the American Community Survey, we have data from 2022. For measures that we have from the National Vital Statistics System, so that's all of our mortality and natality data, we have data from 2021. And then for quite a few measures, so both of our air pollution metrics, we have data from 2023. And then we also have data from 2019 for third grade reading scores, or sorry, from 2024 for unemployment. So we have, where we can, we have close to in real time data, which is really exciting. And then finally, this is just kind of takes a look at our updated racial ethnic categories for our city demographic tables and maps, which I highlighted in the city overview part of the site. So we provide, like I said, really granular breakdowns, racial ethnic breakdowns for all of our cities. But in the past, we've only been able to provide demographic, the most granular categories for our for specific racial ethnic categories. And we haven't been able to provide data for folks that identify as multiple racial ethnic categories. And that's because we've been limited by our data set, which is the US Census. So recently, the US Census changed its methodological method, or its calculation methods, and changed some of its questions to allow for respondents to identify as more than one race simultaneously. And they've also added expanded categories or expanded racial ethnic categories. So we now have more detailed categories for Central Asians, Central and South America, for Native Hawaiian and Pacific Islander, subgroups. And so you can see in this screenshot, the example of the types of subgroups that we have for South America, for example. And just, I wanted to highlight that we now have, with this change and with this update, over 97 race, ethnicity, and age group categories that the user can choose to explore in their city. And so that's a lot of information. And I can just open the floor now. Any questions, feel free to take yourself off mute or just drop them in the chat. Happy to answer anything.